serving as a consultant at renowned institutions including Alta Integrative Medicine and Wellness Complex of Perpetual Health Medical Center Las Piñas, Tree of Life Wellness Center, Centro Holistico, and Simply Healed Medical Group, where he practices integrative oncology. Please join me in welcoming Dr. Jansen Calalan. Let's all watch this.
Hello mga ka-Simple Nature! Please follow our social media accounts, our Facebook page, Simply Nature International, our IG account, Simply Nature-inc, and of course, our YouTube channel, Simply Nature. Don't forget to subscribe and click the notification bell for more updates.
Hi everybody, welcome to another episode of Simply Healed, and today, this afternoon, we have again with us Dr. Jansen. Welcome back to the program, Doc.
Hello, Shyan. Hello, everyone. Glad to be here again.
Alright, so we've been covering a whole series of cancer that is female-oriented.
Yeah.
we talk about breast cancer for at least 3 episodes, right? We talk about mastectomy, mammograms, DNA, whether it runs in your family or not. And today we are continuing with that female slant. All right, we are going to talk about cervical cancer today. In fact, cervical cancer, according to the statistics, is the second leading cancer for ladies in Philippines.
Yeah, correct. That's correct.
So, okay, let's jump into the topic. So if you have loved ones who I'm sure all of us has a mom, and many of us have sisters and daughters. So I think this is something, a good topic. Hope we learn something. You will learn something this afternoon. And let's start with an interesting tidbit. Doc Jansen told me that this is one cancer that you can get vaccinated for. Yeah. That you can actually prevent this cancer if you got vaccinated.
Yes.
So, Doc, what's cervical cancer and how come it can be vaccinated?
Okay, cervical cancer is, simply put, no, it's a tumor that grew in Tagalog, sa kwelyo ng matres. So it's in the cervix. Okay, so the cervix is located between the lower part of your uterus and the upper part of your vagina, or your vaginal canal. Okay, so we have something called the endocervical junction. That is where your cervical cancer originates from. Okay? So it is primarily caused by a virus. It's called the human papilloma virus. So since it's caused by a virus, you can get vaccinated for it in order to prevent you from getting cervical cancer later on, which I will discuss in a while.
So okay. how we proceed today? You're gonna share with us what causes cervical cancer?
Yeah. So, like what I've said a while ago, the human papilloma virus is the causative agent of cervical cancer. But it doesn't necessarily mean that once you get infected with HPV, then you will get cervical cancer immediately. Okay? And not only for women, the human papilloma virus is also the cause for your anal cancer, your rectal cancer, your penile cancer. So for men, so that is the same thing. Yeah, it's the same thing. It's very significant as well.
Okay,
I'm
listening now.
Okay, so this is not only for women but also men as well. Okay. So how come it's not necessarily that way? No, it's because most HPV infections in male, in women, no, have little long-term clinical significance. So 70% of women clear the infection within a year, and more than 90% in 2 years. So you can just imagine, no? So our own body clears up this virus on its own. So our immune system fights it. Okay.
But is HPV very common? Statistics that your slide said that 50 to 80% of sexually active teenagers and young women are actually positive for HPV.
Yeah, that's very true, especially when you are sexually active, because HPV is transmitted sexually. Yeah. Okay. So if you are really sexually active,
so it's almost 8 out of 10.
It's
wow.
Yeah.
Okay.
So the prevalence is really high in getting infected, but it's actually in your lifestyle whether or not this progresses to cervical cancer. Okay. Hi guys. Before we continue, I would just like to remind everyone, if you have any questions, just comment them down below and we're going to answer them later in the live Q&A. So here are some of the risk factors that can increase your chance of getting cervical cancer. So number one is if you have a lot of sexual partners. Okay. Another one is if you engage in sexual activity at a very young age. Right. Some HPV can also be carried by sexually transmitted illnesses, the bacteria of sexually transmitted illnesses. So that would be your gonorrhea. It can carry HPV as well. Okay.
So actually, cervical cancer only comes from HPV.
Yeah.
Wow. So that's it's like a single cause.
Yeah.
We can identify exactly how you develop cervical cancer.
Yeah. Majority, actually, at least, I think it's at least 95%. Yeah, at least 95% HPV is the cause, because there are other causative agents like DES. DES is diethylstilbestrol. So that is back in the old days, a few decades ago, I think in the probably the 50s or 60s, they've been using that substance in birthing assistance, of birthing. So that chemical can actually cause cancer, cervical cancer, not only cervical cancer but vaginal cancer as well.
So actually, cervical cancer can be prevented since the cause is highlighted to one. I mean, one major cause, and it's HPV.
Yeah.
And if we can manage HPV, you eliminate cervical cancer.
Yeah.
And yet, it's the number 2 leading cancer in Philippines.
Yeah.
Sayang, ah.
Yeah, it's very ironic, right?
Yeah.
To think that we're a Catholic country, so the teachings is actually to be monogamous, but the reality is no, it's not happening. Okay.
What else? What are the other risk factors?
Okay, so another risk factor is a weakened immune system, smoking, and again, exposure to the miscarriage prevention drug, DES. So later we're going to be zeroing in on the influence of your immune system on the occurrence of this cancer. Okay, so next let's move on to the vaccine. Okay, who should take the vaccine? It's actually both men and women.
Even men.
Yes, even men.
Men should get vaccinated. Wow, HPV.
Men are the carriers of HPV.
Also, the women can blame the men for cervical cancer because we are the. Oh wow, okay.
yeah. It's the men who are the carrier. But of course, if you as a woman you are highly active sexually, right? And then if you have multiple partners, then of course you can be a carrier as well, right? So in order to prevent cervical cancer, number 1 is HPV vaccine. Number 2 is screening. You have to undergo pap smear and the HPV DNA test. And number 3 is lifestyle intervention. Okay?
For the vaccines.
Yeah,
let's
for
go
the
to the
vaccines
vaccine.
first, we have actually 3. Previously, we only have 2. Okay? So that is your Cervarix and your Gardasil. Right now, we have Gardasil 9 already. So I'll be discussing the difference between the 3. First, let's go for the Cervarix. So Cervarix, it is a bivalent vaccine.
What's bivalent?
Bivalent, it just means that it has 2 strains of HPV contained in it. So you form immunity against 2 strains of HPV.
Okay.
Okay. So for the vaccine schedule of this, it's 0-1-6. It means that for your second dose, that would be a month interval between the first and the second, and then 6 months after the first dose. Okay.
So it's 3 injections.
Yeah, it's 3 doses.
And then that's lasts for the whole life.
Yeah, that's a lifetime immunity. Okay. So for Cervarix, the age range of those who is qualified for vaccination for this vaccine is 9 to 25 years of age. Okay. If you are more than 25 years old, would you be qualified to get this vaccine still?
Okay. Why is there a age?
It's an age, right?
Maximum.
Yeah. It's because the study that they've conducted this vaccine in is the population of those participants are between 9 to 25 years old. They haven't tested the efficacy of the vaccine for those who are more than 25 years old. So that is why. And then why not younger than 9? Because the vaccine is not effective for those who are less than 9 years old. So that's the meaning of it. Okay? Now, if you're asking, what if I am already, for example, I'm already 35 years old, 35 years old. Is there still a chance for me? Of course. We have Gardasil 9.
Okay.
So, for Gardasil, both the regular Gardasil and the Gardasil 9, the schedule is 0 to 6. So the only difference is the 2. So you get your second dose 2 months after the first dose. Okay? So remember that. Now, the difference between Gardasil, the regular Gardasil, and the Gardasil 9 is the number of strains that you get immunized for. So Gardasil protects you for four strains. So that is why it is quadrivalent.
Quadrivalent, all right.
So Gardasil, the regular Gardasil is for male and females who are 9 to 26 years old. Okay? And then for the Gardasil 9, this one is non-abated. That means you get protected from the 9 strains of HPVs.
Wow.
So this one actually even protects you from getting warts. Because the warts,
like genital warts.
Genital warts. Because genital warts, the causative agent of that is also HPV.
So it really seems like for the viewers out there who are single and not married, and are sexually active, it seems like you should go for HPV vaccine.
You should.
Is there any downside? We are in a vaccine season because COVID-19 vaccine, right? There's so much discussion. Now, are these 3 vaccines like any of the COVID-19 vaccines, or they have been tested for?
Oh,
okay. What's the difference? Because
okay,
safety-wise.
This has been in existence for decades.
For decades.
It has been studied extensively already, and I myself had the Gardasil vaccine.
Oh,
yeah, I did.
Okay.
3 doses. I only felt heaviness on my arm on the injection site, nothing else. Even with the other patients who are asking me to give them this vaccine, only pain on the injection site. It's like
so it's absolutely
soreness.
safe, like your BCG. There are no
it's
long-term
absolutely
side effects.
Yes,
There's
yes.
nothing to worry about. No mRNA or anything.
No. This one is actually the HPV. Some portions of the HPV virus itself, in order for our immune system to recognize that virus.
Doc, so does this mean that if you are above 25 years old, you won't get HPV?
You still can.
But the vaccine, there's no vaccine. There is Gardasil 9 now.
Yeah.
Okay. So if you are above 45 years old and you don't have HPV and you're still going to be active, so there's no protection that you can get.
You can still get vaccinated for Gardasil 9, but the efficacy will not be as strong anymore.
Okay.
Yeah.
So basically, there's an option all the way to age 45.
Yep.
So to all our viewers out there, Gardasil 9, right? Just remember that name. Go and look for your physician. You can look for Dr. Jansen, all right?
And it's always good to talk it out with your physician whether or not you are a good candidate for this vaccine, whether your lifestyle still warrants it, right?
How much?
Okay, so next is, this one is more or less mandatory, but still depending on the stage of your cervical cancer. So that this is concurrent chemoradiotherapy. So what does this mean? While you're undergoing radiation therapy, you are also undergoing chemotherapy. Now, why do they do this?
Yeah, why both?
It's because if you do not if you do not administer chemotherapy to cervical cancer patients, the cervix will not respond that much to radiation therapy. The cervix is not really that sensitive to radiation treatment. That is why you put in cisplatin in order for the cancer cells to multiply. It's to force the cell cycle in order for the moves to divide.
To stress the cancer cell.
So to speak. It's more on to sensitize the cancer cells to radiation.
Okay.
Now, once these cancer cells are sensitized, then you kill them with radiation
therapy.
Yeah, so that is how it works. So the most common chemo drug that they use for this is cisplatin. So cisplatin is also a radiosensitizer.
Oh, cisplatin is a radiosensitizer. That's something new I'm learning today. And the good news, right? The good news for all our listeners over there, our Simply Nature PPAR extracts are specifically tested with cisplatin, right? And we have found that it protects your bone marrow,
Yeah,
your
the bone
spleen
marrow, yes.
from the damage from cisplatin. So this is
Yeah.
the best news for all cervical cancer patients out there. Call us up right now, make an appointment, a consult with Dr. Jansen, because your primary treatment, which is cisplatin, is something our product is specifically tested for.
Yep.
And it works to protect you, so you won't have all the side effects. You minimize all your side effects from cisplatin. You do well for your chemo, and you'll come out clear.
Yes.
Yes.
Correct.
Very
correct.
exciting.
Yeah, this is.
I was so happy when I saw the slide. It says cisplatin. I said, "Wow, that's exactly what we tested our product on."
When I was still an intern back in St. Luke's Medical Center, I've rotated in the radiation oncology department as well. So I've observed a lot of brachytherapy cases. So
what is brachytherapy?
Brachytherapy is just another mean of short-range radiation treatment.
Okay.
So usually, what we do for radiation therapy is that you lie down on a sort of like a stretcher, right? You lie down there. Then there's it looks like a flashlight, but it's not really a flashlight. When you just lie down, then the radiation is shot through your body.
Okay.
So yeah, it looks like a flashlight, but of course you cannot see the light, of course. But so that is your external beam radiation therapy. Brachytherapy is different. So brachytherapy is wherein they insert a rod, wherein they put in the radioisotope in order to irradiate that.
So it's
immediate
more
area.
localized.
It's localized. It's a
It's
localized.
more localized.
treatment.
All right.
So brachytherapy is used to treat cervical cancer and prostate cancer as well. So that is what they do. Okay. And of course, if you are thinking, hey, would this be very bad for my body? I mean, you are simultaneously administering chemotherapy and radiation therapy to my body. Won't I die from it? You won't die. You will not die from this, but you will be very, very weak. I've seen a lot of cancer patients undergoing this. They're really thin. They're really weak. So my advice to you, if you are currently undergoing one right now, take Simply Nature PPARS, because the Simply Nature PPARS will be able to protect the other parts of your body, like your bone marrow, especially your bone marrow, because the white blood cell count is a very important issue here.
Especially for recurrence.
Yeah, especially for recurrence, and your immune system largely depends on your WBC count. Another one is your hemoglobin, because of course the bone marrow is where our red blood cells develops, right? So if the bone marrow is destroyed, then the amount of red blood cells produced by our bone marrow also decreases as well. So that is also a concern, because aside from it being a carrier of oxygen, which also determines the effectiveness or the effectivity of your radiation therapy. Of course, you might also have some symptoms of bleeding, spotting, which of course that is blood loss as well, no? So yeah, Simply Nature PPARS does wonders for this.
If a person wants to like try naturally, I mean, is there like, okay, you want to try, you try for 2 months. If it doesn't work, then you better go. I mean, is there a time frame you would say they can try?
You can afford to do it if it's stage 1.
Okay.
You can afford to do it if it's stage 1, but you have to realize, no, you have to accept one way or another, if the current treatment, the current natural treatment is not working, then you have to use all of these modalities. So how long would you wait? I'd give myself 6 months.
Okay. Very clear guidelines, all right? So those who want to treat yourself naturally, you're in early stage 1 or cervical cancer, maximum 6 months. But doc, definitely they need to go and monitor themselves to make sure it doesn't get worse, right?
Right.
All right. And because the reason again, because the chemoradiotherapy will work.
Yeah.
Right? It will cure you because you are stage 1, stage 2. But I know you just want natural, so 6 months. After that, go for it. And here's the good news. The cervical cancer treatment uses cisplatin. And Simply Nature PPAR is tested with cisplatin.
Yeah.
So good, right? We can reduce the majority of the side effects. Dr. Jansen's patient is shopping when even though she's going through chemo. No hair loss.
No. She did not lose hair.
Anyhow, that's great news to all the women out there, right? So I think today's program is fantastic, Doc. First time I heard you give a clear, you can try natural for 6 months, but after that, no.
You have to go for...
You go for this one. And this
Yeah.
one is 100% you're gonna get well, and we have the Simply Nature PPARS that will prevent all the side effects and complication, and to also prevent you from having recurrence. So right now, take action. Arrange for a Simply consult with Dr. Jansen so that you can confirm. If you want to go natural, he will start the 6-month clock.
Yeah.
All right, and then he'll follow up with you. If not, you'll be going for the treatment. He'll support you through your chemotherapy so that you have no side effects and you'll do so well, like his other clients. All right.
Yeah.
All right. So if not, Doc, let's move to the Q&A.
Right.
All right, let's go to live Q&A right now.
Hello mga ka-Simple Nature! Please follow our social media accounts. Our Facebook page, Simply Nature International. Our IG account, Simply Nature-inc. And of course, our YouTube channel, Simply Nature. Don't forget to subscribe and click the notification bell for more updates.
Much, Doc Jansen and Sir Shyan, for that very encouraging discussion. I'm sure that our viewers have learned so much and has come up with so much questions in their minds. But good news, we are now in the what we call AMA, or Ask Me Anything portion. But first, before we go to our questions, let's quickly greet our viewers for tonight. Starting off with Ms. Helen Kamunayan, Ms. Jeanette Ku from Child House. Hello po. Ms. Lali Moreno, Noemi Elona Veras. We also have Priscilla Ocfemia, Daisy Andres, Noemi Veras, Donna Rakisa, Nessie Ocampo, Nay Sarang. There. And of course, Dr. Grace Lim Kalalang. Good evening po. Thank you for watching us tonight. All right. Now, at this point, all right, let's not keep you waiting. I can see some questions are coming in also. Now, to answer our questions in this modern world filled with noise of different health opinions, trust the ones from the experts. To answer our questions for tonight, I'd like to call on once again our lifestyle medicine doctor, Dr. Jansen Kalaran, and of course, our CEO from and PPARS expert from Singapore, Mr. Shyan Lim. Good evening, Sir Shyan, and good evening, Doc Jansen.
Good evening, Sheila. Good evening, Doc.
Hello, Sir Shyan. Hello, Sheila. Good evening to everyone.
Yeah. Okay, let's start. Let's get started. It's 8 o'clock already. Yeah.
It is. All right. So for the first question that we have here, it was thrown privately to our inbox, coming from Miss Mary. How effective is the treatment for early stage cervical cancer, and can you still have healthy pregnancy after the treatment? Very good question.
Oh, interesting.
Yeah, very good question. Okay, for cancers, no, as long as it's early stage, you can actually achieve curative effects, no. So, in other words, if cervical cancer was caught early, especially in stage 1, having it excised, actually cures you of it.
Wow.
Yeah. Okay.
You know,
Yeah.
just for all our viewers, Dr. Jansen is very careful with the word cure. All right. All doctors are very careful with the word cure because they will always say manage, treat, or in remission. So when Dr. Jansen uses the word cure, I hope that encourages you a lot. Yeah. For the person who asked this question.
Yeah, very important. But of course, no, depending on the exact stage, depending on the biopsy result, you might be recommended by your gynae-onco for an additional treatment like radiation therapy. So just to make sure that everything is cleared out. Okay. So to answer the second question, can you still have a normal pregnancy even if you were diagnosed with cervical cancer and got treated of it? The answer is yes. Okay?
Wow.
The answer is yes. You can. As long as it's early stage. Okay, but of course, if it's advanced stage, getting pregnant would be very difficult. Yeah, it would be very difficult, and it's not advisable to get pregnant, okay, because there is a mass located in the cervix. Okay, so that's gonna cause problems with the baby. Yeah, when the baby grows big.
So for this particular viewer, my advice to you is immediately have a consult with Dr. Jansen, all right? If you're asking about early stage cervical cancer, so that's really good news. Most of the time, early stage cancer detection is almost by God's blessing, because it's usually very difficult to detect early cancer. Is usually when a person goes into looking for other things and accidentally finds the cancer. So for that particular viewer, please don't waste time. Don't wait tonight. Immediately have a consult with Dr. Jansen. Book his earliest appointment. Every single week, every single day that passes is precious time, because if you want to be able to successfully have childbirth and to treat this, it's already amazing that you detected an early cancer. So please act on it now. Yeah.
Thank you. All right. We're talking about cure. The next question is coming from Ms. Ransford Dialde. Can PPARS cure UTI and thyroid nodules?
UTI, no, because UTI is an infection, so you need antibiotics for that. Thyroid nodules depends on what kind of thyroid nodule. In my experience, no, I've handled patients who have benign thyroid nodules, and we've tried using PPARS to address it while waiting for the biopsy. Some patients' nodules do regress. So when they go back to the doctor's clinic for biopsy, it was not done because the nodule was gone. Okay.
Yeah.
If it is cancer, we cannot just rely on PPARS, no, to treat the cancer. So I usually use other modalities, other treatment modalities to help fight the cancer. Okay? Yeah.
Thank you.
So-
Thank you, Doc.
So the
Jhen?
answer is a big yes. Again, for this particular viewer who asked this question, have a consult with Dr. Jansen, right? And quickly get started so that you have a combination of different types of protocol, especially if you're trying to explore a natural approach to cancer. That means you want to avoid conventional medicine. But, you know, I want to assure you and other viewers, because of Simply Nature PPAR extracts, especially our liquid, conventional medical treatment like chemotherapy is actually very viable now, because we can manage your side effects and protect your bone marrow. All right. So keep your options open. Let Dr. Jansen know what is your preferred approach, and let him also advise you on the red lines. What do I mean by red lines? If you choose a natural treatment to cancer, you should also set a timeline that, you know, if things don't improve, then you will quickly use conventional medicine also. Combination. So it's not that you give up natural, but remember, cancer is a fight against time. Especially you want to treat it without letting it become the next stage, right? Because once a cancer moves from second stage to third stage, the success rate drops. And then when it reaches fourth stage, the success rate is really very small. But yet in the early stage, stage 1, stage 2, many cancers are actually more than 90% success rate. It drops to less than 30% for the later stages, depending on the cancer. So you don't want to waste time, all right? So again, I encourage you to quickly make an appointment with Dr. Jansen so that you can get going with your treatments.
Exactly. For those of you who wish to have a consult with Dr. Jansen, just simply type in how to consult. Our caring HCS will definitely get in touch with you individually. All right. Next question coming from Ms. Shamsi Pare. Can PPARS be harmful for liver? Because I've been taking PPARS tablet for almost a year now, but it seems that my cholesterol and triglyceride, also my SGPT and SGOT were elevated.
Yeah, I have to see you.
Okay.
But in general, chlorella, the microalgae, chlorella, spirulina, these microalgae don't have, it doesn't harm the liver. It actually even helps the liver heal by lowering inflammation, lowering fat, enhancing fatty acid metabolism. So, if by taking PPARS, your cholesterol, triglycerides, your blood parameters are still elevated. We have to find out where is it coming from, why is it elevated. Yeah, because remember, PPARS is not a medication, okay? It's a supplement, right? It's a natural product. So, although it is effective, no, if you look into studies that look into hundreds of people taking the product, you see the improvement, but there are outliers. Okay, so what by outliers, there are some people wherein it doesn't work or it doesn't respond. So of course, we don't know why it didn't work unless we talk to the patient and investigate. Yeah.
Further. All right. Yes, Sir Sean?
Yeah. No. I just want to say, yeah, everything that Dr. Jansen said. Right.
Thank you. Thank you, Sir Sean. Thank you, Dr. Jansen. All right, for our next question, coming from Ms. Jeanette Koo. Dr. Jansen, how about transvaginal? Through transvaginal screening, can we detect cancer from this?
Okay, I'm gonna guess. Transvaginal probably means transvaginal ultrasound.
Yeah.
Yeah. Okay. For transvaginal ultrasound, yes, you can detect cancers through it. However, if a tumor appears on transvaginal ultrasound, usually it's big already. So, depending on what kind of cancer that we're looking at, if it gets detected in transvaginal ultrasound, say for example, it's cervical cancer, then that cancer is already in the advanced stages, locally advanced. Okay. If it is ovarian, then doesn't always necessarily mean that it's advanced. Okay, because the ovaries is more secluded. It's found deeper, no, inside the body. So it really depends on what kind of tumor we're looking at. But usually, if a tumor is detected with transvaginal ultrasound, it may be advanced already. It may be locally advanced already. So you have to get checked. Now, not all tumors are cancer. Okay, some tumors are benign; they are not cancer, but it is a mass. Okay, so if it is so, then well and good. You can just have it removed surgically. Okay, it can also be physiologic, meaning it's normal. Okay, so some cysts that we find in the ovary is normal. It's physiologically there. All right. An example would be a woman ovulating. So that ovulation will be detected by the ultrasound. We would be able to see it through an ultrasound as a cyst. So don't panic. Okay, if you see such things in your ultrasound, go see your doctor and have your doctor interpret it for you. Don't let ChatGPT interpret it for you, okay?
Yes.
Don't let AI interpret it for you. Go see a real doctor. Okay? Yeah.
I agree.
I just want to make a comment, here since Doc mentioned ChatGPT. For everyone, ChatGPT and AI is always an assistant. All right, it's always an assistant. You have to do fact checking the AI. So please don't treat ChatGPT or AI as the final word, especially when you're gonna decide on a treatment protocol. As Dr. Jansen says, you can always use ChatGPT to better understand what the doctor told you, or you can even use ChatGPT to prepare some questions for the doctor, right? But please see a doctor and not just decide using ChatGPT. Thank you, Dr. Jansen, for bringing this up. Because AI is such a fad right now. Everybody thinks that AI can do everything. No, it's very helpful, but no, a doctor is still needed. All right.
I agree. But I just say that here in Simply Nature, this is also the reason why we want our patients well coordinated with their doctors during their journeys also. Okay. All right. For our next question coming from Ms. Rina, I just want to ask what this bleeding between periods mean and when should I be concerned? Thank you.
The fact that you have bleeding in between periods is a concern already. You have to go see your OB.
Oh, wow. Okay.
You
So
have
aren't you
to,
going to watch this program tonight because Dr. Jansen gave you a very clear direction, right? So again, don't delay. Go and make an appointment with your OB-GYN.
Exactly. Doc, just very curious. For those who have history of cervical cancer or ovarian cancer in their families, and they just want to, prevent it early, what's the best modality? I'm sure it's not the trans V. I hope it's not the trans
Um,
V ultrasound.
okay, for cervical cancer, it's always the pap smear and the HPV DNA test. That's always the best. That's the gold standard, actually. For ovarian cancer, it's just the ultrasound. It's just the ultrasound. Yeah, there's no other way to screen for it. Uh, by not having ultrasound. Usually, actually, ovarian cancer. Why is it very difficult to treat? It's because usually when women develop symptoms, not like abdominal pain, it's usually locally advanced already.
Oh, okay. So
Yeah,
by the time
unless
you discover,
Mhm.
it's already borderline stage 2 and 3, is it?
Usually yes, usually yes. If a patient comes to us, right,
Mm,
with abdominal pain, and then we go and do a scan,
mm.
then we see an ovarian mass. Usually it's already big. If it's
Wow.
big, at least it would be stage 2. Yeah.
Mm.
So
Okay.
yeah, only big tumors will cause pain, right? So
Yeah.
yeah. If usually we catch stage 1 ovarian cancers through a routine abdominal scan. So I've had this patient.
Mm,
Quite young.
mm.
Mm, she was only in her early 30s, like 31, 32.
Okay.
She regularly has an abdominal exam, abdominal ultrasound, in their annual physical exam with their
Wow.
company.
Okay.
And I think she and her husband is also trying to conceive. So she had a general
So then they
checkup.
do the scan. Yeah.
Yeah, they did the scan, and lo and behold, there was a mass that was found in the scan. So
Wow.
they did the biopsy. Turned out it was malignant, so they had her
Ah.
ovary removed. So they
Oh,
left the other one because
okay.
they wanted to conceive. They wanted to have a
Yes.
baby. So they did not remove the other one. Okay, yeah. So we have had these kinds of patients.
Wow. Again, you can see, to everyone how having regular checkups,
Mm.
your annual checkups, these are all things that are good practice. Just thank you, Doc, for mentioning this. I turned 50. I have yet to do my prostate examination, so I guess I should go and get it done. All right. Okay. Thank you for the reminder. And
Thank
for
you.
all our viewers, all these regular medical checkups are not something that you should avoid,
Yeah.
yeah, correct. That's it.
Yeah. Take advantage of it, I'd say. All right.
Yes. Yes.
Okay. All right. Thank you, sir. Thank you, Doc Jansen. Next question. Okay. Good evening, po. What are the usual risk of the chemotherapies for cervical cancer, and can PPARS safe? Uh, is PPAR safe to be taken while on chemotherapy journey?
Yeah, the answer is yes. No? So for cervical cancer, the chemotherapy usually used is cisplatin. The role of cisplatin uh, in cervical cancer treatment is a radiosensitizer. So it sensitizes the tumor to radiation therapy. So radiation therapy is also being done, no, at the same time with the chemotherapy in a cervical cancer patient. Uh, why is it why do we combine chemotherapy and radiation therapy at the same time for the cervical cancer patient? It's because the cervix it is not that sensitive to radiation therapy. You have to sensitize it first so that it would be so that it would respond to the radiation therapy. Yeah. Okay, that's how it is. Now, side effects of cisplatin is a lot. You can have ototoxicity, so hearing problems. It can also impair your kidneys. You can lose your hair, tank down your immune system, fatigue, etc. Radiation therapy also has those side effects, except that it's more localized. It can affect the skin. It can also make you, develop more fatigue. Um, yeah, to some patients, but this is a complication already, no? It can actually even burn. the surface of your urinary bladder and your rectum. So some patients do develop fistulas. Fistulas are a connection between these organs. Okay, so some patients can develop a fistula between the rectum and the vagina, even the urinary bladder and the vagina. Okay, so these are bad complications. Okay, so for Simply Nature PPARS, its role for cervical cancer patients as a supportive therapy would be to help manage the fatigue, the immune system. It's to improve your immune function much better. Another one is to protect you from inflammation. Number four is to help you recover after you finish the chemotherapy and radiation therapy. Okay, so that's the role of PPARs. The question would be, what kind of PPAR product would be appropriate for you? So that one I really have to talk to you. But if you can afford the liquid, go for the liquid. So the next question, is it safe to take at the same time? Yes, it's okay. When I looked into the mechanism of action of cisplatin and Simply Nature PPARs, Simply Nature PPARs can help protect the bone marrow from the harmful effects of cisplatin, but it will not protect the cancer cells from the effect of cisplatin. Yeah, so it's okay to take them at the same time. Okay. However, if your oncologist tells you not to take it at the same time while you're having chemotherapy, then please don't. Okay. This is because this is to give respect to the oncologists, number one. Number two, this is so that the oncologist would be able to pinpoint some, if there are some side effects that you develop, some toxicities, it would be easy for the oncologist to pinpoint where the toxicities came from. Okay. Why am I saying this? Because your oncologist might not understand how PPARs work. Okay, so if you have some oncos, who are like Sono, just ask Simply Nature's team to talk to, for them to talk to your onco. So yeah, so everybody would know how it works. So after all, it's gonna be your body. At the end of the day, our goal is to help you, right? So yeah, but on my side, it is okay to take them at the same time. It is okay. But in case you have your onco, then you have me as your doctor also. I also tend to advise patients, okay, let's follow your onco. Just don't take the PPARs on the same day that you're taking the chemo. You can take it, the day after, 2 days, 3 days after. That will be okay. Simply Nature PPARS' effect on the immune system is not just one day. Okay, if you prepare yourself months ahead, then your immune system would be strong enough so that even if you receive the cisplatin, the radiation therapy, your immune system won't tank down so much. Yeah, and if ever that you really need injections to bring up your white blood cell count, you will need that high of the dose. So this is filgrastim. So you won't need that high of a dose. It would your white blood cell count would easily go up. So I've encountered these patients as well, wherein these patients their white blood cell counts went down to 1,000. One. Yeah, that's low. That's low. Just with one injection of filgrastim, it went up to 15,000.
Yeah. Because they are taking Simply Nature PPARs.
Yeah. Just to let you know, this patient, we share, Doc Jimmy and I shared this patient. We're managing this patient. So Doc Jimmy also knows.
Wow, I'm just gonna ask Dr. Jimmy about that because that's amazing, right? It's I think it's so encouraging, Doc Jansen, and so much for your. It's so wonderful your chosen field of specialization to be able to support medical conventional interventions like filgrastim with natural and make the effect so much better for the patient. It's just a win-win-win for the actual patient. Wonderful. And to this particular viewer, I want to assure you something. The actual chemotherapy drug that we test our extract liquid on is actually cisplatin and oxaliplatin. So definitely it can. But as what Dr. Jansen says, usually we don't want to, we just want to respect your oncologist and not create any obstacles, make it easier for your oncologist to accept the support of PPARS during your chemotherapy treatment. And again, for all viewers, if you are seeing an onco and the onco is telling you not to take or whatever, then please let us know. Just drop us a note on Facebook Messenger. We will actually send a medical representative to go to your onco, and we won't tell them your name, okay? We will just say that there's a patient who inquired, so doc, we are here to explain to you. And then after that, your onco should be comfortable with at least you deciding to go on the protocol. So we have a team of medical reps to help explain to your onco. So please send us the name of your onco and which hospital, and we won't divulge that it is you who sent. We'll just tell him that there was a patient, one of his patients, many patients, right? He has, and then we will explain. All right. So we're always ready to support. All right.
All right. And it's always for the purpose, of course, helping more cancer patients in your hospital too.
Yes.
Okay. All right. Thank you, Sir Shyan. Thank you, Doc Jansen. Next question coming from Ms. Lali Moreno. Oh, can glutathione help a person with cervical cancer?
It depends. Okay, the answer is it depends.
Okay.
Glutathione can be it can be a double-edged sword. Okay? If a cancer patient, okay, this is not just for cervical cancer, no. This is true for all cancer patients. If the cancer patient is undergoing radiation therapy and chemotherapy, then it is okay to receive glutathione to manage the side effects. However, if the cancer patient is not on chemo and radiation, you are utilizing other treatments, then glutathione can actually even protect the cancer cells because cancer cells also use glutathione.
Yeah, wow. Okay.
Very
Now,
informative.
I just wanted to ask you, our human liver actually produces our own glutathione. Can I ask you if a patient takes glutathione artificially, that means via injections or capsules? I've also heard of, I've heard of maybe these particular patients took a lot because they want to be super white, they want to be Snow White very fast. Can taking glutathione supplements in high dosages actually end up hurting your liver? Or is it okay?
Not really. It's fine.
Okay.
It's fine.
It's
Yeah,
fine,
as long as the quality of the glutathione is very, very good. Yeah,
Okay,
because
so
there are
a lot of cheap Me Too
yes,
products. In
yes.
Philippines, every time there's a hit product, then you see 10 different brands come out, and some of them may cut corners. Yeah.
Yeah. Anyway, I'm going to say this. Anyway, all of us are adults here, no?
Yeah.
Usually you get what you pay for. If the product that you paid for
If it's
is
too
cheap,
cheap, you should worry.
yes. Yeah. Cheap shit is still shit.
Yeah.
Okay. So be careful. Be careful of where you receive your glutathione, where you get your glutathione injected. Okay, because there are a lot of cases. You don't have to go far. You can just
Oh,
search the internet. Everything will appear about glutathione's harmful effects. Yeah, those are horror stories, right? So be
wow.
careful. Be careful.
Okay, I want to share with everybody when it comes to natural supplements. Really, really natural supplements. We're not talking about vitamin C tablets or multivites or vitamin E that you get from very famous shops like Healthy Options and things like that. Okay, I'm just talking about natural supplements. I want to let you know that natural supplements, the better it is very likely that it will be expensive. Okay, let me share with you why. All right. Because natural supplements cannot be reproduced that easily. Okay, it's not like drugs. Drugs are chemically synthetic chemicals, or they are synthesized, so they can be done on a large scale with with high yield. All right, and they are very consistent. Okay, however, natural supplements it needs to be like grown in a particular place, right? Like Cebu like mangoes grown in Davao will taste better than a mango tree in Metro Manila. Okay, so there is actually limitation. There is actually limitation. So for example, like cordyceps and all that, truly good cordyceps or ginseng are grown on naturally on mountains like let's say the ginseng. So there's only a very limited quantity. So if a product becomes hot and popular, the price will actually go up. So the most expensive ginseng, one ginseng, which is enough to make one bowl of soup, is actually like $40,000 or 100,000+ if I'm not wrong. Okay, and because the supply is limited. All right, so it's very different. That's why your Manuka honey and all that is expensive, right? Because commercial honey, how you make it is you put an entire wall of sponge 1 meter or 2 meters away from the beehive. So the bee just fly from the beehive to the wall of the sponge wall with glucose, sugar, water, and that's how they make honey. It's very different from real Manuka flowers in the field that the honeybee goes to, right? So that you are limited in your quantity that you can produce. So I hope everybody understands what Dr. Jansen says is really even more true for natural supplements. The moment a natural supplement becomes very popular, it doesn't mean that the supply can suddenly increase to meet the world demand. So the price will actually go up. Okay? Yeah, just to let you know why is it more expensive. Okay.
May I say that this is a very good topic to discuss since we are also celebrating this month, the International Women's Month. So we are encouraging and also warning, may I say, the women out there as we empower them too. Yeah. Okay, for our next question coming from Miss Andrea, question is, what are the differences between a pap smear and an HPV test?
Oh.
Very good question. Pap smear is getting a direct sample from the cervix. So that would involve you, as the patient, lying down, opening up. Then the doctor would have to open the vagina using a speculum and getting a sample inside the cervix. Okay? An HPV DNA test usually only involves just the blood, a blood sample.
Sample.
Okay.
So,
yeah.
The cervical, the sample that was taken from the cervix, that can also be submitted and checked for HPV DNA, since it's already a direct sample from the cervix. Yeah, so
which is more accurate.
Yes, more accurate. More accurate. Pap smear, HPV DNA test actually is the more accurate one. But the sampling is very important. Yeah.
Okay, as you said earlier, this is a gold standard to detect those cervical cancers. Oh, okay. Thank you, Dr. Jansen. All right, next question, thrown to us privately by Miss Althea. Very interesting. Since cervical cancer is caused by virus, can it be transmitted via body fluids like saliva?
It can, but HPV is mainly transmitted through contact, skin-to-skin contact. So that can be the skin. It can be the mucosa. So oral sex can also transmit HPV.
I was about to say that oral sex can actually transmit HPV.
Okay, all right. Thank you, Doc. Thank you, sir. Next question, coming from Miss Marie. Good evening, po. I just want to know how do PPAR agonists interact with chemotherapy and radiation therapy?
PPAR agonist, chemotherapy, radiation therapy. I answered that already earlier.
Yeah. So I will add one part.
Okay.
It doesn't react with the chemotherapy drug. All right. It doesn't work on the chemotherapy drug, which is why there is no contraindication. Neither will it reduce the efficacy of your chemotherapy and radiation therapy, right? So it doesn't react with the radiation or the chemotherapy drug. What it does do is that it protects the healthy cells from chemotherapy damage. All right, by strengthening the healthy cells. And I won't go into the science too deeply, but the mechanism of action doesn't work on cancer cells, as Dr. Jansen mentioned. Also, very important is that PPARS works on your cell's ability to mature. Okay, so this affects your red blood cell count and white blood cell count. Again, it's not working on the cancer cell, neither is it working on the chemotherapy or drug or the radiation therapy itself. It's actually working on your healthy cells. That is how PPARS is. That is how I will answer your question. So that is added onto the understanding that Dr. Jansen already gave earlier today. Yeah.
Exactly. Thank you. Thank you, Sir Shyan. Thank you, Dr. Jansen. Okay, another interesting question thrown to us privately. Okay, coming from Ms. Hazel. Good evening po. Can cervical cancer cause lower back or leg pain? I'm having back pain for a long time as well as in my legs, though I'm not doing anything that can fully strain them. Is there possibility that this is cervical cancer?
Thank goodness you asked that question here. And you did not Google, because if you had Google, the answer would have been yes. But okay, that symptom that you are feeling, you usually see that in cervical cancer patients who are in advanced stages, stage 4. Yeah. Why? Because the cervical cancer would have metastasized to the spine, which might have caused that symptom. Okay, but of course, no, if you have cervical cancer really and you have this kind of symptom, then you would have been bleeding heavily already. Yeah, so that is the missing link. That's the missing link. So the next question is: do you have bleeding in your vagina? Abnormal bleeding? Do you have foul smelling vaginal discharge? So if you have those things, then yeah, the suspicion of cervical cancer would have been higher. However, since you did not mention anything about discharge, then the answer is though the symptoms that you're feeling would have been related to your muscles, musculoskeletal strain. It can be also attributed to your spine. So, what doctor should you go to? What doctor should you go see? It would be an orthopedic doctor. Yeah, that would be actually my advice to you. Go see an ortho. Yeah, but if the pain is really bad, you can come and see me. I can inject prolozone in your lower back and try to help relieve the low back pain and the strain, the straining. It might be because of just muscle pains, no? So yeah, but if you really want to see a specialist, orthopedic doctor would be the best. If you come and see me, and upon physical exam, you really need really need further investigation, then I would be requesting for an MRI of your spine and to see why you are developing such a symptom. Yeah.
And another possible thing for lower back pain and aches, and when you go and see Dr. Jansen, one of his clinics that he has hours with is Central Holistical. So I'm not sure, Doc, if Central Holistical uses acupuncture for back aches.
Yes.
Okay,
Yeah,
so
they do. So you can also go there.
Yeah, that's another option. All right, that's another option. Okay, so there you go.
Yeah, I just want to tell everybody that our two gentlemen, Sir Shyan Lim and of course Dr. Jansen Kalalan, are also aware and also an advocate, may I say, of TCMs there.
Yeah,
Thank
we
you.
both
Thank you.
actually took a TCM course. Yeah, it's just that we have not completed the thing fully yet. Alright, but we know enough to be able to appreciate and let you know what TCM can or cannot do.
Thank you. Thank you for sharing, Sir Shyan, and thank you for sharing, Dr. Jansen. Okay. For the next question, so from Mon Mosong Song, please do a follow-up comment as to what diagnosis you have, because the question is how many PPAR tablets do I need to take every single day?
Okay, I can make a quick guideline for this one.
Yes,
If you're doing therapeutic, right? Therapeutic. And if it's not mild, that means it's like if you're borderline diabetic and things like that, yeah, minimum is 20 micro tablets. So you can take 10 micro tablets twice a day. Okay, but if you want therapeutic, your minimum is 20. Actually, I would definitely feel more comfortable with 30. That means 10 micro tablets 3 times a day. Because you want a therapeutic effect, all right? And don't worry, there's no upper limit to the dosaging of the PPAR tablets and even our extracts. And I want to assure everybody, our products have actually undergone LD50 testing. Very few products actually do that, all right? That means we go for testing on very, very high dosage to see if there's any toxicity effect. At the 50 times lethal dosage, all we saw was a slight hyperactivity in the first 3 days, as the body learns to acclimatize to the high dosage of PPARS that you're taking, and after that you don't even get the hyperactivity anymore. So really, there is no worries on the dosage, and for therapeutic, go for at least 20. Actually, personally, I would definitely say 30. I say 20 because I am appreciative of the fact that in Philippines, some of our clients are low end. I won't say low end, sorry. Some of our clients are provincial, and the pay in province is lower than the pay in the cities, right? So, however, the benefit is that the lifestyle in the province is usually also better. The air is cleaner. You're more peaceful. By 7 p.m., all the stores are more or less closed, so you have a more healthy lifestyle as well. So 20 tablets is the minimum for therapeutic, but I will encourage you to do 30 if you want to see a significant effect quickly.
Thank you. Thank you, Sir Sean. Thank you, Dr. Jansen. All right, I think this will be our last question for today. All right, coming from Miss Angeline. Doc, I just want to know, are there any lifestyle factors that will increase the risk of having cervical cancer?
Oh yes, oh yes. It is actually a lifestyle disease.
Yeah, it's one of sexual activity actually, right?
Yes, yes. So, okay, if people have early coitarch is the medical term for the first sexual encounter. Okay, so early coitarch or early sexual encounter or encounter in a very young age is a risk factor. So when I say it's a risk factor, it can increase the risk of developing cervical cancer. That's one. Number two, if you have multiple sexual partners. So if you have, so this goes for both male and female. If you have different sexual partners, may it be woman to woman or man to man, yeah, cervical cancer can increase. No, it's the risk for cervical cancer increase. For men, we do not have cervix. So what is it inside? What is it in our body that can develop cancer? It is the penis. So if you do not want the second head to develop a third head, so please restrain yourselves. Okay, so that's another. Yeah, another one would be obesity. Now this has something to do with metabolic problems already. So obesity, diabetes. Now HPV. Okay, this is the causative agent of cervical cancer. HPV is a virus. How HPV leads to cervical cancer is through inflammation. Okay? Well, it's a virus, so it's an infection, meaning your immune system can actually kill the HPV. So if your immune system is working properly and you are not in an immunocompromised state, then you would be able to fight off the HPV virus.
Wow.
Now, what conditions do we have that can suppress your immune system? Number one is if you are obese. Number two, if you have diabetes. Yeah. Number three, if you're on chronic steroid use.
Okay, that's for example, heart problems.
Yeah,
Or
heart
even-
problems, autoimmune. Yeah, if you're using steroids, so that can be a possibility. So that's another. The last one would be genetic risk factors. So there are people wherein they have genetic, I should say, not abnormal, not genetic abnormality, but they have genetic uniqueness. Genetic uniqueness, wherein it's very easy for them to develop cervical cancer once they get infected with HPV. Yeah, so there are situations wherein, it's just like that. So how do we know this? Right now, I don't know of any method or any that would give us an idea if you are prone to develop cervical cancer if you have an HPV infection. Yeah, so having said this, the best way to fight cervical cancer is by preventing it in the first place from happening. So the risk factors I have mentioned, make sure you're not doing any of those and make sure you are vaccinated. leukemia.
I agree.
Okay. I just want, before we close off the night, I just want to answer Simon.
Yeah.
He said he was diagnosed with acute lymphoblastic leukemia, remission from from his last bone marrow biopsy. All right. So, and he finished his 8th cycle of chemo last month. So, Simon, I thank you for coming onto this program. I want to really advise you, and encourage you to have an appointment with Dr. Jansen. I join you in your joy that you are in remission. I just wanted to bring this up because I've had the burden, I would say burden because it's sad, right? Of meeting many cancer patients who were in remission and then had a reoccurrence of their cancer. It's like, they say, oh, I was in remission 6 months ago, but now my cancer came back. And then they're wearing a scarf on their head again because obviously they're going through their new cycles of chemotherapy. And they look at me and said, so Shyan, why did this happen? What did I do wrong? I thought I was already in remission. So I want to take this opportunity to speak to Simon. To all these cancer patients, I always tell them, you didn't do anything wrong. Obviously, you chose the right protocol because you got into remission. Now, the question is, how come you have a recurrence? So for all patients, right, the moment you're in remission, it's not your time to relax. This is the time where you should actually focus a lot on the natural side of how you can strengthen. And because once you're in remission, the oncologist has nothing to give you anymore, okay? Because you do not give drugs to a person who's no longer sick, right? So when you are in remission, there is not much more that the oncologist will be able to do for you, right? Your scans are all clear. He cannot be prescribing you another 6 cycles of chemotherapy. There's no reason to, because your results are clear. And then he'll just say, come back 6 months later, we do another CT scan and keep monitoring. However, there's the moment, the day after your scans come out to say that they are clear, actually, you need to go into action straight away already. What do you need to do? You need to meet a doctor like Dr. Jansen and ask his advice. What can you do to strengthen yourself so that the chances of a reoccurrence will drop dramatically? All right, so I want to encourage you, Sheila, just to ask you, what happened when Dominic's cancer markers, when they all become normalized? What did you do for Dominic for the next few years for him to cross the 5-year mark? What did you do?
Well, I've learned this from you, Sir Shyan, from Doc Jansen, from Doc Medi, and all the doctors that I've been watching in this webinar as well. We stayed vigilant with the lifestyle of my child, as of course we really don't want the recurrence. As you've mentioned before, I can remember this, that once recurrence occur, that once there's a relapse or recurrence, the medication will be different. It'll be a lot more aggressive as well, because the previous one might not be as effective, or work anymore. So, and this is also something that we also share with our patients here. Stay vigilant when you cross over the remission.
Yeah, but what did you actually do, for example? What does Dominic take?
We stayed on, of course, with PPARS. We continued communicating and coordinating with our doctors, definitely. But in terms of PPARS, we stayed on with it. It's still up until now, I must say.
And Dominic has crossed the 5-year mark.
He did last year. Thank you, Lord.
Okay, so I just want to share with Simon again, I also met another patient, not on PPARS, all right? This patient is actually 25-year cancer survivor. That means she's been cancer-free, not for 5 years, 25 years. Yet, she walked into our office and asked about PPARS. That I just want to share with you. So why she's constantly not saying that, relax. She's just constantly understanding and looking for products that can help strengthen her immune system, keep her healthy, keep all her metabolic syndromes in check, and all that. So, Simon, I join you in celebrating that you're in remission, but I want to encourage you straight away make an appointment with Dr. Jansen. Find out what you should do for the next few years until you hit the 5-year mark, and what to do after that as well, so that like the client that walked into our office, She stayed cancer-free for 25 years, yet she is still looking to understand what more she can do so that she will be cancer-free for the rest of her life. And we wish that for you as well, Simone. Yeah.
Yes, I just want to say that you don't know how happy we are when you reach out to us, just being vigilant, and we recommend the basic ones to you, not the extracts actually.
Yeah. Yeah, correct.
That means you are in a good track or in good shape as we. All right. Well, at this point, well, that's all the time that we've got here, but we still have one question to answer, that which I would want you to answer while you are doing the parting words for our viewers tonight. Can we do that? All right. So the question is coming from Miss Emily Alyon. How about for ovarian cancer stage 3? Doc, what PPARS to take? You've mentioned this earlier, but I think she just wants a reiteration for this one. Who would like to go
Yeah.
first?
I'll go first.
Okay.
So for all cancers, no, not just so ovarian cancer or not just stage 3, no, if we just go for a blanket recommendation, it should be the liquid. It's always the PPARS liquid. Okay. Why is it the PPARS liquid? Why is it the one that I'm recommending? Because it has the highest concentration of PPAR agonists, and you want the best product for yourself, no? Because you have cancer, all right? Now, the only time that we consider taking the other extracts like the powder, the soft gel, is when it's when we want to tailor fit the protocol for your situation already. So one example would be say you have you are vomiting again and again and again. So you why take the liquid if you are vomiting repeatedly? You just vomit a very expensive vomit. Okay. So in this regard, no, I really have to talk to you so I can make the right prescription. I can write you the right prescription. But just to let you know, it's almost always the liquid. Yeah, as a recommendation. Right? So I just go right into my parting words. So for that matter, no, for all our patients out there who are, a little bit confused on what to take, it's always best to go see a doctor to guide you. Rather than just, reading stuff on the internet, reading stuff that you might not even understand. Or yes, you might be able to understand the things that you're reading because you have AI, but the things that you're reading might not be applicable for you.
Yeah.
So it's not gonna match anyway. So yeah, best to still go see your doctor. And of course, no, for cancer patients, it's always a good idea to take a protocol. So meaning your supplements must not be only one. Okay. We have to utilize other supplements to address cancer because cancer already has 14 hallmarks. These 14 hallmarks are what makes cancer cancer. It what makes it grow. It what makes it progress or worsen. It's what makes it come back, recur. It what makes it happen in the first place. So we have 14. So just imagine. All right. So definitely just taking one singular medication or supplement will not work if you have this. Chances for failure would be high. All right. So I leave it at that. I'll give the floor to Sir Shan.
I want to echo what Dr. Jansen said, and I add one more thing. You also have to ask and see the right doctor. Okay, you have to ask and see the right doctor. This is now personal. This is just personal. But this is how I would advise you to. How shall we say? How do you pick a good doctor? Number one, doctors that don't want to answer any question from you or they talk down to you. These are generally doctors that I think the Philippine word is the Tagalog word is mayabang, is it? That come across mayabang. Yeah, I would find a doctor that will actually talk to you. and listen to what you have to say. And this is very easy to understand, right? If as you ask questions, the doctor says, don't ask questions, then that means he's not listening to you. He's not being attentive, right? As a doctor, it's very important to know what the patient is going through so that they can make the right diagnosis as well. So another one that I would always say is also, if the doctor is very dismissive, that means like, no, that one won't work. No, if you want to trust me, then don't do any other thing. I think, okay, why do I say that? I won't say that that's a bad doctor, but then I would really consider and be mindful. I might go for another second opinion. Okay, the reason is this. Medical science, especially with AI being added into research, is moving forward very quickly, right? I don't know whether viewers, you know this or not, but AI speeds up research by quite a lot. So what it just means is that every year now, there's going to be breakthrough medications, there are going to be breakthrough protocols. So if a doctor does not have a learning attitude, that means he may not be aware of the latest thing or the latest understanding about cancer that has changed. You know, last time, remember, they told us butter is bad for you, then butter now is good for you. Why? Because medical science understanding, it keeps evolving and improving. So if you meet a doctor that is very dismissive, that means his attitude towards learning might be very closed off as well. It might be because he's under a lot of stress, he doesn't have time to read journals and whatever. But anyway, to me, I would want a doctor who is still inquisitive, a doctor that wants to find out what are the latest new developments, whether it is conventional medicine or natural, right? Or what new diets can support cancer, for example. So I remember, and with this I will close. I did a presentation last year in 2024 at the National Children's Hospital, National Children's Hospital in the Philippines. Okay, and after I did my presentation, one of the doctors who are sitting right in front, one of the front tables, all right, because she's a very senior doctor, she's actually one of the first pediatric oncologists in the Philippines, and she's already senior citizen, right? Past 60. So she's a very experienced, very respected, and a pioneering oncologist. She actually stood up and took the mic, and then this is what she said to me. This is what she said to the whole room of doctors, right? She said, she introduced herself, and she talked about her specialization, and she said, you know what? I'm a very experienced oncologist, but I am still very interested in finding out novel approaches, which means new approaches to treating cancer. And then she said, I would like to have some time with you to ask you more questions. Okay, wow. This is a good doctor, right? Even a senior citizen, she is still open, she's still inquisitive, she still wants to know what other methods are there to treat cancer. So when you select doctors, so select a doctor if you're not sure, then go and see Dr. Jansen. And then Dr. Jansen can introduce you some oncologists that he trusts and knows, who is like him, always at the forefront of the medical innovations. Okay, so I leave that with you on how Dr. Jansen is absolutely right. You got to ask a doctor, but then I'm gonna add another thing. Ask the right doctor, okay? Or else you might get wrong advice. All right. So wrong. Let me stop that. All our doctors in Philippines, in Singapore, everywhere, they're all qualified. But you may not be getting the best advice. They will all give you good advice, good medical advice, but it may not be the best advice. It may not be the most cutting edge. It may not be the most up-to-date advice. But you can trust all doctors. They will give you good advice. Their intention is to treat you. So yeah, I correct the words I use. Gotta be careful, gotta be accurate, and gotta be fair to all the doctors out there. Me and my wife just talked yesterday because one of our staff has a medical emergency, and he was calling for a doctor to be on call. So, and I said to my wife, doctors are pretty amazing. Even at 3 a.m. when they're on call, when they're on duty, they have to rush down and treat a patient. So I said to my wife, doctors are actually a very noble profession, a profession that requires a lot of training and a lot of heart. It can get very tiring. and yet they are always on the ball when when they're on duty, and they rush to always go and save lives. But then again, so with that, I just want to close. Respect your doctors. However, also have some wisdom, right? So that you can get the best advice. Okay. Thank you. I'll hand the time back to Sheila.
Sir, I just want to add what you said a while ago. And I've learned this from you. I also ask the right questions. All right. Well, I totally agree with Sir Shyan. Go to the right doctors. Just like I just feel blessed here in Simply Nature because we have doctors like Dr. Jansen, Dr. Joy, Dr. Jimmy Katapia, Dr. Johan, and a lot more doctors are really concerned, and just like Sir Shyan said, exquisite to really to ask the right questions for them, right? And to their patients as well, to know more about the condition. So there, speaking about being blessed, on behalf of our patients tonight, thank you so much, Dr. Jansen, and also Sir Shyan Lim for answering our questions for tonight. And we, of course, look forward to next week as we answer a lot more questions coming from our viewers. Now, at this point, I just want to say that if you have a loved one battling any type of cancer or any health issue at all, remember, science is evolving and new treatments are emerging all the time. Keep informed and explore all available options. So don't forget to like our Facebook page, Simply Nature International, and Dr. Jansen's FB page as well. And also do subscribe to our YouTube channel. Now, this is also to make sure that you get updated with our latest promos and events. Now, please, guys, everyone, check out our website. That's www.simplynature.ph because we have our ongoing website and direct order promos, wherein you can actually get 200 or more than 280 pesos discount when you buy either the PPARS powder jar or the PPARS liquid extract box. And also, you can get 1 pack of soft gel capsules that's worth 3,700 pesos free, just for you, if you buy 6 packs of PPARS soft gel capsules. So once again, these promos are actually up until the end of March 31. So what are you waiting for? Now is always the best time to get the best health, not only for yourself, but of course for your whole family. So experience the benefits of PPARS at an unbeatable price. So once again, we hope to see you in their future webinars to come, particularly the next week's episode, March 20. This is entitled How It Feels to Be Cancer-Free. Now, this is happening once again, Thursday, 7:30, same day, same time. Okay, so thank you so much, everybody, for watching the Simply Healed webinar tonight. This is powered, once again, by SMG, or Simply Healed Medical Group, and Simply Nature International. Because your curiosity about your health conditions and your victories over cancer and other metabolic illnesses are what keeps us going here in Simply Nature. Because here in Simply Nature, we're always with you from start to healing. Thank you, everybody. Good night, and God bless you all. See you next week.